So when we talk about veins, uh, as opposed to what we about arteries, in arteries we start at the heart and we move out towards the organs. Veins, you have to start at the periphery and move back towards the vena cava. Because that's the way the blood flows. So we don't talk about branches, we talk about junctions. They come together. So uh, so there's basically a couple of concepts. One of the concepts is that the is that veins are constantly getting bigger. Uh, Another concept is that there are two sets of veins. There are the deep veins that run alongside the arteries and are named the same as the arteries. And then there's a completely other set of veins called the superficial veins that just run under the skin. Draining areas. So there's kind of basically two sets of drainage in each area. The deep veins are very easy to name if you know the names of the arteries that correspond to them. So when we look at a schematic like this, or the anatomical like this, what we see is that the most of these are named for the same. So there's an anterior tibial and a posterior tibial and a femoral coming into the common iliac, or the external iliac, which comes into the common iliac, which then ends up in the inferior vena cava. We're going to see that there's a radial and ulnar vein that come together to form the brachial, which then becomes the axillary vein, which becomes a subclavian, which then comes into the brachiocephalic, which then goes into the superior vena cava. The names are pretty much the same. The superficial veins of the limbs have other names. There's a very large vein that runs from basically the ankle up to the crotch on the medial side of the lower limb, called the great saphenous vein. It's an important vein for doing surgeries. This is the vein that they harvest to do bypass surgeries in the heart, because it's long and it doesn't have very many branches. The only trick is to make sure that it goes in the right direction so that the valves don't cause problems. Up the lateral side of the leg, not the thigh, is one called the small saphenous vein, and it drains the lateral side of the calf. In the arms, in the upper limb, there is a vein that runs on the medial side up into the armpit, the whole length of the upper limb, called the basilic, because it's on the basal side. It's on the downside in anatomical position. And there's one that runs up the lateral or upper side called the cephalic. Now there's some branches that join the two in front of the elbow, and the elbow is the cubit, so it's the median cubital. This is the one that they do phlebotomy on. They take blood usually from the median cubital. There's also one that runs up the middle of the forearm called the median antebrachial, and it's just a superficial one. It's the one that you see if you make a fist and look at your forearm. So this is the drainage of the neck. Instead of the carotid, it's called the jugular vein. Something of note is that there are two brachiocephalics, a left and a right, where there's only one brachiocephalic artery. There are left and right veins. There is a system of veins that um, drain the thorax, the ribs. It's called the azygos system. On the right side, there is a vein called the azygos vein. Azygos means without twin. Um, and so the whole right side ends up draining into the superior vena cava right here. The left side, however, all drains into two veins, one called the accessory hemiazygos and the other one called the hemiazygos, which means half of the azygos. And both of those drain into the azygos before they end up back in the vena cava. Okay, another concept of veins. There are some veins that start in capillary beds and they end in capillary beds. They're called portal veins. Last semester in AMP1, we talked about it when we talked about the pituitary gland. Well, there's a hugely important one called the hepatic portal vein. And really what it is it takes all the area, all the stuff that's supplied by the celiac trunk, by the superior and inferior mesenteric arteries, and brings it all back to the liver. So it starts in the capillary beds, in the intestines, in the spleen, etc. And it ends in capillaries in the liver. And then the liver itself is drained by the hepatic veins into the inferior vena cava. What this means is that anything that's absorbed into the digestive system ends up going to the liver before it goes into general circulation. So nutrients can be stored and things can be dealt with. It has profound effect for drugs, because any drug that's taken orally ends up being absorbed into the hepatic portal veins, goes to the liver, and can be neutralized by the liver before it actually gets into circulation. If that's the case, and you don't want that to happen, then you have to give the drugs intravenously, or like through some sort of an injection. You have to bypass the digestive system to do it. Again, there's the vein coming from the spleen is the splenic. The inferior and superior mesenteric basically drain the corresponding areas from that, and it all ends up in the liver via the hepatic portal vein. An interesting sideline with veins here in the abdomen into the inferior vena cava is that the renal veins drain the kidneys directly into the inferior vena cava. On the right side, the suprarenal vein drains into the vena cava, and the gonadal vein drains the gonads, the ovaries or testes, into the inferior vena cava. On the left side, however, the suprarenal and the gonadal drain into the renal, and that's because the renal vein all these veins have to get over to the right side of the spine, and they're low pressure, so there could be blockages. So it's way better just to bring the blood all into one spot and bring it across the spine all together in the one left renal vein. The implication of this is that the left side, especially of the gonads, has less efficient blood return than the right side. And that's why the left testes always is a little bit heavier and hangs lower. That's why the left ovary is more prone to ovarian cysts and things like that. It's just a sideline. It has clinical implications, though. There's a testicular problem called uh, vermicell, uh, and it it happens on the left side 99% of the time because of this anatomic fact. This is what the hepatic portal veins end up looking like. Again, we're not naming them. In the leg, I've already said it, the great saphenous and the lesser saphenous, or the small saphenous, are the superficial. The deep ones actually have the same names as the arteries. And it ends up looking like that.